we're all incredibly thankful for NEDA for facilitating this research, and hopefully in the next hour you're going to hear some really exciting things in which the basic research is flowered. So I'm a professor emeritus at Stanford University and a research professor at Palo Alto University, where I'm also the director of the Center for M Squared Health. And now I want to introduce Dr. Ellen Fitzsimmons-Kraft, who is an assistant professor at Washington University.
Thanks so much, Bar. I'm so excited to be here today. As Bar mentioned, I'm an assistant professor at Washington University School of Medicine in St. Louis, and I'm also a licensed clinical psychologist. And my research and clinical work has really focused on eating disorders, and most recently have conducted quite a bit of research, much of it in collaboration with Bar and others, on how we can harness technology to scale treatment for eating disorders, as well as improve training for therapists. And I've also been really excited to collaborate closely with NEDA over the years to make available our team's evidence-based online screen for eating disorders on the website. So really happy to be here today to talk about this work, and I'll pass it over to Michael Rouse from X2AI.
Thank you, Ellen. Hello, everyone. I'm Michael Rouse. I'm a peer support counselor myself. I used to be a patient, and then I started helping other people. And then at some point I figured it's hard to split yourself in many pieces and help more people. So like, are there other ways to do that? And that's kind of been my life's work now. And yeah, excited to tell you more about how we put together the chatbot to actually make that happen. I'll pass it over to Romy.
Hi, everybody. I'm Romy Sadlick. I work with Michael at X2AI, and I've been working very closely with Bar and Ellen and their entire team on making this possible through our chatbot. And I'm very excited to be here. Really appreciate it. I'll pass the token over to Rob Morris.
Hey everybody, I'm Rob Morris. I'm a co-founder of Coco. We're a tech-based nonprofit created by a team out of MIT and Airbnb. And we work with large social networks to bring digital mental health interventions to as many people as possible. And I am delighted and excited to be here. So thank you for including me. And I will pass it to Matt.
Hi, everybody. Thank you for watching this webinar. My name is Matthew. I am a PhD candidate at Dartmouth College, and my main role and responsibility here is statistics and statistical methods for digital mental health. And broadly, I'm kind of interested here in using those statistical methods to see how Tessa and this chatbot really works out in the real world, implemented not just in a research setting, but in a setting that can help anyone who needs it. And so excited to talk a little bit more about this work, but with that, I'll pass it on to Dr. Nicholas Jacobson.
Hi, everyone. My name is Nick Jacobson. I am an assistant professor in biomedical data science, psychiatry, and computer science at Dartmouth College. I do work related to using technology to deliver treatment to folks at scale and also to try to enhance assessment. I'm going to be talking today a little bit about kind of a very flexible chatbot that we are about to open up trials on. So I'm excited to talk to you all.
Okay, I will start sharing my screen and begin the presentation. So I'm very excited to be here, and we've been working together in various ways in the last 3 or 4 years. I think NEDA has been instrumental in putting this all together, and the results I think have been both satisfying and really important. And a little shout out to Romy, because when we began this, you were really instrumental in helping us stay focused and helped us with the incredible study that we'll be talking about in just a moment. So deep thanks to NEDA and the Feeding Hope grant that supported this effort. It's so generous and important that NEDA is helping people do research for all of the folks that are affected by eating disorders. So let me give you a little bit of background. A lot of what we're going to be talking about today really focuses on prevention. So there's an urgent need for prevention of eating disorders. And I'm going to talk a little bit about the background. That will be followed by Ellen presenting the results of the Feeding Hope Tessa chatbot study. All of the programming occurred with X2AI. I think you're going to find these results, frankly, incredible. But even equally interesting is that Romy and Michael and the X2AI team took Tessa and they began to employ it much more broadly within their community, which was very exciting. And then we were incredibly lucky to learn about Rob's work and his team, and really how they can begin to identify people on social media with weight and shape concerns, and then provide a version of Tessa to help them. And then finally, we thought we would pique your interest a little bit of the future of a truly conversational chat box meant to get fairly close to a human discourse. And on this panel, we have people who are deeply expert in all of these things. So background, tell you a little bit about the need for eating disorder programs. You heard that I'm a professor of psychiatry at Stanford and a research professor at Palo Alto University. So weight and shape concerns drive a lot of the issues for people. They're incredibly common, probably affecting half of the people in the US. And what is unfortunate is that weight and shape concerns and internalization of the thin body ideal are causative factors for risk factor for eating disorders. So my work and Ellen's work for a long time has been trying to find ways to provide programs to people at risk of developing an eating disorder that will both help them feel better about themselves and prevent the onset of the eating disorder. Now, we do know that weight and shape concerns not only cause eating disorders, but they cause a lot of personal distress in and of themselves. Now, what is kind of distressing is that, as you may know, NEDA has an incredible screen that we proudly helped put together that has been helping probably close to 1 million people look at their risk for eating disorders and then begin to find services. So the NEDA screen is an incredible contribution to preventing and treating eating disorders. But what we have found from Ellen and other people's work is that about 10% of the people who complete the screen are at risk for an eating disorder but don't actually have one. So there's a large population, think of 1 million people, of 100,000 people who would benefit from a program to help them improve their body image and reduce their weight and shape concerns. So how do we do that? Well, there are programs available that can reduce the risk factors. And we also have some evidence that the use of these programs can reduce the onset of eating disorders. So that's incredibly exciting. We have programs, they're effective, they reduce risk. But the problem is, nowhere can you get these programs for a whole bunch of reasons. And one of them is because our society doesn't put enough emphasis on prevention. And to make the situation even more complicated, we've done research showing that some moderation actually makes the programs more effective. So we have a lack of reimbursement for prevention in society, and the proper, probably the best prevention involves some sort of a moderation or interaction. So what are some solutions? So the problem is, how do we provide affordable, effective, scalable ED prevention programs? By that, I mean programs that people anywhere with these kind of concerns could use, who are identified by NEDA and other screens and other, while providing moderation. So chatbots may be one solution. So a chatbot is a computer program designed to simulate a conversation with human users, especially over the internet, blah, blah, blah. We all talk with Siri all the time. And we were very lucky to be funded by NEDA to see if we could take a program that we know works in many contexts and put it online and make it available to everybody as a chat box. And we were incredibly fortunate to run across X2AI and to begin to work with them to see if we could actually make this happen. So you're going to shortly hear about what's happened from this story. Ellen's going to tell you about the results, and then we'll think about it again as almost like 1,000 flowers blooming or birds taking off and flying. I don't know exactly what the metaphor is, but the kind of progress we've made in taking an effective program available to few, showing it could be put on a chat box, and judge for yourself whether it can then be effective, and then finding unique and important ways to distribute it to others. The Tessa team, I won't go through everybody's name, but we're indebted to a large number of people who are sort of impassioned about prevention. And I do think we do owe a lot to all of the customers or participants in the studies that we're involved with. Without many folks out there being willing to undergo randomization and get a treatment or not, and in many other ways provide sensitive, important information about themselves, we wouldn't be able to do the important work that we do. So thank you very much. And with that, I will then turn it over to Ellen.
So that was a really wonderful introduction. And now I am really excited to talk with you all about, as Bar mentioned, we were so fortunate to receive funding from NEDA through a Feeding Hope Fund grant to actually test the effectiveness of this chatbot for eating disorders prevention that we developed. And as Bar mentioned, worked very closely with X2AI to host and program on their platform, which, we've been really excited about that partnership for the reasons that, when I turn it over to Michael and Romy shortly, can lead to actual dissemination of this program in the real world. So, following up on some of what Bar said, our team led by Bar and our close colleague, Denise Wilfley, for many years have studied an eating disorders prevention program that we refer to as student bodies. So this was traditionally delivered as an 8-week web-based program. It consisted of traditional web-based page sessions long ago. They were about 20 to 30 minutes in length. And what the team has found is that that program does significantly reduce weight and shape concerns, which Bar mentioned is a really important risk factor for the onset of an eating disorder among women who are already at high risk. So among women who already have pretty elevated levels of these concerns, and we know are at high risk for conversion to an actual clinical problem, this program has really been shown to reduce those concerns. And it's also been shown in the very highest risk groups to actually reduce the onset of an eating disorder. And as Bar mentioned, what we've found as well is that guidance from a human moderator improves outcomes to the program. So this has traditionally involved, a human moderator being there to provide, motivation to continue with the program, to provide some personalization, about how the program might be a good fit for your goals, and to encourage, application of skills in real life. And traditionally, this human moderation often took the form of text-based communication, via users and moderators. But of course, all that takes time. And as Bar mentioned, here in the US, we don't have a big focus on prevention. There's not easy methods for reimbursement of these services. So, certainly costs to provide that kind of human moderation to the, 100,000 people we've already identified at NEDA who are at high risk for an eating disorder really limit our ability to be able to disseminate this prevention program in the real world. So our thought was that we could program a chatbot to mimic aspects of moderation. So, as I mentioned, a human moderator can, serve as a motivator to get you to come back to the program, maybe get you thinking about how you can apply these skills in your daily life. And there's ways that we can program a chatbot to do exactly those things without any human kind of element, or, thus, no human time sort of costs. I think also, programming a chatbot to deliver this intervention, makes the program more accessible in a modern format. So in our case, we were programming, Bar mentioned Siri, so that's a voice-based chatbot. In this instance, we're talking about, a text-based chatbot that you can access, via something just like your regular old text messages, which we know everybody is in all the time. So, that as well, bringing this intervention to where people are on their phones, and making it really accessible in this, easy to use format. So that was sort of our goal. And, in terms of more broadly, the research on chatbots for mental health, this is just beginning to explode. But certainly we're seeing, more and more of this, including from, being driven by many of the people on this, this call today. And what these results have shown is that these chatbots do look like they can hold a lot of promise for improving mental health more broadly. The interactivity that they can provide can really mimic therapeutic conversation, which can be beneficial. They can really encourage honest disclosure. This is a completely, again, robot or anonymous being that one can interact with. So some people may find it easier to be, more honest, and it might decrease, feelings of shame that could get in the way of disclosure. These interventions can also be used anytime, anywhere, which is, of course, in contrast to something that needs to be delivered by a human and may generally be really useful for those who aren't ready to talk to a real person, and again may still have some shame that's getting in the way. So in this study that we had funded by the Feeding Hope Fund, what we wanted to answer was whether our chatbot-based eating disorders prevention program, which again was derived from, an established longer web-based program, if we compare that to participants who are just put on a wait list to receive the intervention, after the study, does that result in improved outcomes among women who are at high risk for the onset of an eating disorder? And today I'm going to focus on the outcomes that are really those key eating disorder risk factors. So I'm going to highlight those here today. So as I've mentioned, we reworked that established student bodies program, which is based on principles of cognitive behavioral therapy for delivery via a chatbot named Tessa that was hosted by our friends at X2AI, while still retaining the core intervention principles. So we still wanted to, teach all those same skills and teach those same concepts that we did in that long web-based program, but really, distill things down to very simple text-based conversations. And the program consisted of 8 conversations that covered topics like challenging the thin body ideal, becoming a critical consumer of the media, and this includes of social media, which of course we know can be a big driver of weight and shape concerns as well. We also had a conversation that covered what we referred to as the 4 C's. So, kind of the harm of social comparison, how body conversations can really drive some of these concerns. Again, a little bit more about commercials and the media, and also about, kind of clothing and how that can be a trigger and how to reduce that. We had conversations covering, healthy eating and the importance of regular eating throughout the day, how to handle critical comments from others in your life, how to engage in more healthful exercise versus more driven or compulsive exercise, strategies for managing triggers for binge eating, and then some relapse prevention type strategies. And the chatbot that we developed was really rule or algorithm based. And by that, I mean, it was really based on decision trees or if-then statements. So there was some personalization to the intervention, depending on if somebody, agreed with a statement the chatbot made versus, disagreed, it could kind of send them down different paths. But it really was all, based on this kind of algorithm. But that still provided users with a pretty personalized experience, in terms of, again, sort of based on endorsement or not of certain issues, it might go down one path or another. And really our guiding principles in developing this, text-based conversation was for responses to be really short. We wanted to use infographics to break up text and make the content more engaging. We wanted the chatbot to be really warm, and also, using emojis, since we know that that's sort of, part of our texting culture. And the chatbot was available through SMS text messaging or Facebook Messenger. And this is just some quick screenshots to show you, where we were coming from. So these are, some screenshots of this traditional web-based intervention that we were trying to boil down to the chatbot. And here on the screen, I'm just going to show you a couple of really brief videos depicting what interacting with Tessa was like. So on the left, you can see a transcript of some of the first part of our first session that's kind of trying to help people challenge some body image beliefs, that they may have. They may believe that thinness equals attractiveness and that attractiveness equals happiness. So you can see on the left, Tessa's asking, do you believe these equations? And the person is saying, I do. So then she provides, kind of a tailored response about that. It makes sense that you hold these beliefs, given all the messages out in our culture. But then she asks a question, trying to get people to think about, challenging those beliefs. Can you think of any people that you find attractive, who are happy and who are not thin? And so that's just, again, a very quick video depicting what interacting with Tessa might be like. And then on the right, we have one more brief snippet of a conversation. This is from our healthy eating module. Tessa had shared some about some of the issues with dieting and how that can really drive binge eating. And now she's asking, if the user would like to set a small healthy eating habit goal, based on everything they've learned in that session. And so, this user goes on to say, just as, they talked about in the session, I would actually like to start more regularly. And, kind of they're starting to see that it might be a good idea to schedule snacks in between meals as a way to reduce risk of binge eating. So it just gives you a quick sense of what interacting with Tessa was like. So in terms of our findings, we randomized 700 women who are at high risk for an eating disorder based on having those high weight and shape concerns. And they were about 21 years on average, 85% white sample, 10% Hispanic, and about half or so of the sample identified as heterosexual, with the rest identifying as having other sexual orientations. And what we found is that for weight and shape concerns, again, one of our key eating disorder risk factors, the blue line in the chart that you see represents those who got the chatbot versus the red line being the waitlist control. We found that there was a significant reduction in those who were assigned the chatbot in those weight and shape concerns at both a 3-month follow-up and a 6-month follow-up. So basically their weight and shape concerns improved more so than those in the control condition. We also found that for overall eating disorder psychopathology, thoughts of dietary restraint and other measures of eating disorder psychopathology, the chatbot condition was again associated with significantly greater reductions in those concerns at the 3-month follow-up, although that finding didn't hold through our longer-term follow-up point, the 6-month follow-up. But both groups, as you can see from the chart, did show significant reductions, in that eating disorder psychopathology over time. We didn't find that another key risk factor, so thin ideal internalization, or how much somebody buys into that they should look like the thin ideal. We didn't find that there was differences and changes in that metric between groups, but both groups did significantly improve in terms of their thin ideal internalization. And we also found some indication that the chatbot may reduce eating disorder onset based on self-report data. So that means that these rates are going to be inflated versus if we actually assessed people using semi-structured interviews. We found an eating disorder incidence rate of about 20% or 19% in the control condition versus only 11% in the intervention condition at 6-month follow-up, suggesting that the chatbot may actually reduce onset of eating disorders. In terms of engagement, we found that 60% of our participants who were assigned the chatbot started it, which we would like to improve upon, and maybe due to some of the challenges that we had in the flow of getting people into the study. So that process could certainly be improved in the future. But if people did get into the chatbot, we found that they interacted with it about 4 times on average and spent an average of 11 minutes per interaction, which matches with the length of time that we designed those conversations to be, about 10 minutes on average. So in summary, our chatbot-based eating disorders program was associated with greater reductions in weight and shape concerns versus our control. We didn't find, that effect transferred over to thin ideal internalization, but something that, we might need to add additional content to better target in the future. And also, found some indication, as I mentioned, about greater reduction in eating disorder psychopathology as well. And very promising, we found that our effect sizes were really similar to other work on other digital eating disorder prevention programs. So it suggests that this chatbot-based program works just as well as, other digital eating disorder prevention programs that have been tested in the past. So, we're really excited, again, as I mentioned, about potential to disseminate this program in the real world. And with that, I'm going to turn it over to Michael and Romy at X2AI to share more about that with you. And again, we're so deeply appreciative to NEDA, our study team, the participants, for the support for this project.
Well, again, hello, everyone. I already gave a very brief introduction. Usually I kind of go a little bit more in depth. So yeah, my story started with I myself being a patient and being fortunate to have lived back then in the Netherlands, where access to care is free and wait lists didn't exist back in the days, at least. So I had a very good experience getting access to care and getting treatment. And that's why afterwards, I think I was so excited about kind of spreading the word about like, hey, this is really helpful. Like this can really help a lot of people. And in that way, I kind of became a peer support counselor, just really like following up with people, kind of like telling them about my experiences, sharing what I've gone through and how things have helped me, and then trying to basically help them figure out what would be the best way to support them. So for some people, it's very clear, like they'll just have to get comfortable with the fact of going to see a therapist and breaking through that stigma, which can be very difficult. And especially like if it's a loved one, then they might not want to hear your opinion, but then it's helpful if someone else has an opinion and is there for them. So that was often the role that I played. And yeah, and in that way, it really helps kind of getting people introduced to the idea of therapy. And then what I realized was that with talking with so many people, I often saw kind of the same patterns, like people had the same kind of prejudice and like concerns, and I had kind of the same ways of kind of helping them. And I thought, wouldn't this be possible somehow to scale up? Wouldn't it be possible to use technology for this? And then I studied at a university that was research focused. So I went to the research department, I looked at all the research studies, and I was like, oh, there must be so much data here. We could just do this today and let's do it. Only just to realize that the last time that it was tried was in the 60s. And there was no data available because this is personal, private information that people don't want to share. So that's why I thought like, but it's so helpful, like maybe we can just make something more simple. And that's how we really started with making it so simple. The first version of the product just understood yes or no. And still it's just so valuable that it kind of takes self-help content or an entire course and kind of breaks it down in little snippets to make it more like doable to kind of interact with it. And you'll need less motivation kind of to work through it. And yeah, that was really the main idea at the start. And then luckily more and more people liked it. We got like more and more companies to pay for it for people to get access. We got nonprofits to give access for free to others. We set up our own nonprofit to give access for free to others. And in this way, we get more and more data, which then helps to improve the algorithms and to be able to understand more things than yes and no. And of course, during the research study, we had to keep things normalized, and we had to, yeah, we couldn't suddenly switch to a newer version of the system. but that's kind of one of the exciting things that we'll be talking about at the end, is making this available more broadly, and also on the newer version of our system, which is able to handle more conversations. So yeah, very, very honored to be here today, and yeah, thanks for hearing my story.
All right, well, I will take it from here. So as Michael kind of alluded to, right, we're developing multiple different kinds of chatbots that deliver psychoeducational material. Tessa, as everyone has referred to thus far, is our AI chatbot that has delivered the Student Bodies program via SMS and Facebook Messenger. And this is the wonderful program that Ellen and Bar and the entire team have developed and worked tirelessly on improving it and making the findings that Ellen just presented on the phenomenal findings that they are. So I just do want to give a kind of overview of what Ellen already touched upon, which is what really is the benefit of delivering a program like this through Tessa, through an AI chatbot. So Tessa creates a safe space to discuss sensitive topics free of judgment. And Michael also alluded to this notion of stigma that can come up. So Tessa just breaks down those walls as a non-human support. Tessa delivers an interactive screening tool designed to give people a better sense of their body image and assess risk levels for eating disorders. And this was the screening at the beginning of the study, and Tessa also delivers that for anyone coming in post-study, right, to really give themselves a sense of where they stand before they get into the program itself. Tessa delivers psychoeducational material in an interactive and engaging way, right? So if you're going through a PDF, it can be kind of hard to stay engaged. It's a long, filling out paperwork and et cetera. Going through it with Tessa allows, a person to kind of say, okay, I'm going to be done for today. Tessa checks in the next day and says, hey, let's keep going where we left off, right? Tessa's an accountability buddy, we like to say. And in that same line, Tessa checks in regularly, holding chatters accountable and keeping them engaged with the program.
Yeah, so here's a bit more insight into what happened post-study. And yeah, really, like as I mentioned before, like we always, as part of our mission, want to give as many people access as possible. And yeah, we're forever grateful for Professor Barr and Alan and the entire team at NEDA to make this initial research study possible, because you always have to like do an initial research study to show people it's safe, it's the right thing to do, and then suddenly that opens up more doors to promote things more broadly. So yeah, that's just been phenomenal to have been on that journey, and that's literally been the story of my life for the past 10 years or so. We now have about 10 research studies published, and we have another 11 ongoing. And yeah, every time with more research, there's more trust from people and we can give it out to more people. So it's really exciting. And then what's also interesting to see is really just how many messages people exchange. I remember I myself, when I was helping people and I was texting them from day to day and checking in with them, like you really can only sense like maybe something like around 100 messages per day, but it really gets hard after that point. And that's just phenomenal to see, like this technology just working, and just so many people appreciating the check-ins and responding to it. And yeah, you'd easily get up to like 100,000 messages, as you see here. So it's just, yeah, really, really fascinating. And also an exciting thing that we can do is kind of in our work post-study is where we kind of integrate things with also existing customers. So we have customers who make this available through insurance or through the employer and through all sorts of avenues. And that actually allows us then to solve that problem that Professor Barr mentioned earlier of a moderator being expensive, that we can make sure that they have the budget for us to make sure that there are regular counselors on call or crisis counselors on call, so that we can really make a very comprehensive program out of it.
Yeah, and I did want to highlight a few things that chatters who have gone through the program with Tessa is, when talking about, after completing one of the many sections that Ellen outlined of the program, we ask, okay, so can you rate your body image at this time, right? Your sense of self, your sense of how you're feeling, right? And so a lot of people have great things to say. Thank you so much. You know, I want to rate it 3 out of 5. I'm feeling like a 4 out of 5 today. And then in response to other sections of the program, I'd never actually thought about thinking about it that way, right? So there's this ability, right, to also capture the chatter's experience as they go through this phenomenal program. And at another point in the program, Tessa asks, you know, let's focus on something else about yourself that makes you feel good. What is something that you can think about? And I got to tell you, the answers were endless. I've only selected 3 here. What people have to say about what they love about themselves and the people around them and the relationships that they have is truly wonderful. And you can just see the impact that thinking about these things through Tessa, through conversing and going through this program have on folks. So I've just highlighted a few here: appreciating your compassion, kindness. I love my family. I love my sense of humor. I love my eyes, right? I wanted to highlight these as we're kind of thinking through the impact that we're making here, because it is phenomenal.
And then kind of thinking about looking ahead and what's next and what can we do in the future. I want to take a small step back and kind of tell a little bit more about why I'm so passionate about this and why I'm so forever grateful to be connected with this wonderful team that's on the call today. And that's because at the time when I was kind of tinkering with this technology, and like before it was a chatbot, like I had many other ways I tried to do this. And when I was tinkering with that at the time, my girlfriend at the time, she actually went through a very difficult period, battling like with her own eating disorders and her own body image. And back then it really became very real to me of like, yeah, this is even so much more difficult than other things that you might have to go through. And yeah, really just made me very passionate on making sure we give as much access to people as possible. So over the years, one thing that has helped is to make this available to companies. But at the same time, we started a nonprofit really to make sure that we can give it out to as many people as possible. And yeah, I just want to underscore our mission statement is really to support people regardless of income or location. So really in that way, like our nonprofit is also able to work with any other nonprofits or anyone else, or parents or schools, or like anyone who thinks like, hey, more people should know about this. We're very happy to help people out, and our nonprofit has capacity available to make things available for free when necessary. So yeah, I again just want to put that out there that we're happy to help more people. Just contact us. And once more, thank you so much to the team on the call today, and NEDA as a whole for making this possible. And yeah, really making sure we do very diligent research to make sure everyone feels comfortable with this, and people also really from the research community see that this is really a beneficial way to open up this wonderful content to more people. Thank you.
Thank you. All right, so I'll pass it over to Rob, I think.
Okay, great. So I'm Rob. I'm a co-founder of Coco, and we're a technology-based nonprofit, and our mission is to make mental health accessible to everyone, a mission I think everyone here shares. And the way we approach this is, one, we build digital mental health interventions, which, as we've already heard, is a great way to provide care at scale at very low cost. The second thing we do is we embed our services directly into large social networks or social platforms. So we like to say we work with social networks, not against them. They are uniquely positioned to make an impact. So as much trouble as they may cause, we like to see the positive side of things and see if we can't leverage their reach and their position to make a meaningful and measurable difference on mental health outcomes. So I'll show you really quickly how it works. Just a really quick bird's eye overview. So we use AI and machine learning to find individuals in distress online. So what that means is we build these algorithms and they'll scan text that comes into a social network. So we might look at what someone is searching, what they're posting about, what content they're following, and we'll find individuals who are essentially crying out for help, we will triage them, and then we will treat them, ideally directly on the platform, so we can reach them where they are. We've reached about 2 million people so far with this strategy. Our demographic tends to lean younger, so our mean age is around 18. And the way we connect with people is a bit subtle, and it varies drastically depending on the platform. But to give you a quick user story, let's say, is if you imagine someone maybe late at night on their phone and they're searching for content that might, realistically actually amplify an eating disorder or expose them to greater risk. It's at that moment that we provide some outreach, and it could be in the form of surfacing Coco as a recommended piece of content to follow or engage with. In some cases, we might direct message them directly with our chatbot, but it's really this method of detection and then outreach. So I'll talk a little bit about eating disorders on Coco. In the past 7 months or so, this is where these stats come from. We've seen about 25,000 search terms coming in, users using some kind of search term that matched our list of eating disorder categories. Once people are on Coco, we've seen about 16,000 people self-reporting a struggle with body image or an eating disorder. And so this initially presented a challenge for us. We started working with some new partners where eating disorders were much more prevalent amongst their community. And our primary intervention is a peer support network, but it just wasn't well instrumented for this kind of use case. So people were misusing the service. It was a little hard to moderate. So that prompted me to, in a great rush, contact everyone I knew in the digital mental health space and ask for help. And I was, very grateful and fortunate to engage with BAR's team. And they were so courteous and welcoming, and really helped our team take on this challenge and do something really, really quickly. So what we did was we took a longer body image course, one we've been speaking about, and we tried to condense it radically into about 10 minutes. So it's a big experiment. And, the question is, why make it that short? This is really a pragmatic decision given the way our users interact with our technology. We often have very little time to make an impact. So we wanted to see what we could do in a single session that was very short. So we adapted it, streamlined it, condensed it a bunch, had some input from some of our Gen Z community members, and then we tried out about 7 different versions, and we're still testing and trying different things. We served about 2,000 people with this in the past few months, and I'm gonna pass to Matt to tell us what we found so far.
Thank you, Rob, for that wonderful introduction. And I find myself in this uniquely lucky position to kind of be in the middle of this collaboration where Tessa was passed in a certain version to Coco, and you've condensed it down and are able to deliver it to users in this, meeting them where they're at on social media and capturing these individuals that really need the help. And what I want to talk about is looking at kind of how it's working in this population. And so this modified Tessa intervention was delivered via Coco. And what we were really assessing is changes in body image. And I know we've talked about, Bar mentioned, and I think through all the presentations we mentioned body image kind of being this precursor to eating disorders and really focusing on prevention. And what we found is that this modified chatbot implemented to these people, or to people where they're at, really worked at changing their body image. And these are tables of the statistical models that I ran. But essentially the takeaway here is that of approximately 500 people that were brought into the Coco platform and went through the intervention, we saw a significant increase just in this 10-minute time span of their body image. And so most people started, really low. There's these search terms, they're really trying to amplify this, these thoughts that they have. And just in these 10 minutes, we were able to increase their body image on the scale of 1 to 5. And that's really impressive. And another thing that we ran was not only are we looking at body image, but one really important kind of effect modifier for this is motivation. And so one thing that Rob's team found was that if you ask people about, how motivated are you to change, we find that people who are more motivated to change tend to have greater increases in their body image when they're interacting just in this 10-minute platform, or just in this 10-minute kind of interaction with the chatbot. And I think this really kind of emphasizes that micro interventions in this way, implementing this quickly actually works. And this work really, I think, serves as a foundation for, again, like Bar had mentioned, this flowering of, really taking these research strategies and these interventions and bringing them to the public and expanding kind of their impact with what X2AI is doing. And really reaching out to these people and meeting them where they are. And so, Rob, if you go to the next slide, another really important, thing as X2AI, as Romy and Michelle had talked about, was, people also need to really like what they're doing. If this intervention, it's not going to work if people don't like it. And one of the things that we looked at as part of this investigation into whether this intervention could work in social media in the real world was, what do people think about it? And in the plot on the right, you can see essentially a histogram of people's ratings of this program on a scale of 1 to 5. And overwhelmingly, people are rating this as 5 stars. And the majority are at least above neutral. And again, like Romy had pointed out, we're seeing similar things in Coco's platform of users' feedback saying, this is really great. Like, it's helped me. It made me feel safe. It made me feel loved. And it's amazing. And some of the work that we're doing is actually looking at this feedback. And when we rate this qualitatively, we see that overwhelmingly the feedback is positive. And so really the work that I've done, and I feel, again, very lucky to be in the middle of this collaboration, is show that there is like this foundation for taking Tessa and implementing it and meeting people on social media where they're searching for these terms and making a difference in their body image to hopefully improve lives and prevent that continuation on to an eating disorder. And so I think that, Rob, if you go to the next slide, I think that's, and so again, these are just some other instances of people talking about kind of the chatbot and just really finding it helpful and like showing and continuing to show this evidence that it improves their body image and improves kind of their outlook. Thanks for making me feel like I deserve to eat. These are really powerful messages. And really lends strong evidence to the fact that this work from start to finish, from the research phase to the implementation via the chatbot to this micro intervention, it's getting out there and it's working and it's really making a difference. And I think that that's really wonderful. And so Rob, if you go to the next slide, I think that's it. And with that, I would love to give Rob a chance to close out and also pass it along to Dr. Nick Jacobson, who's going to talk, I think, a little bit about the future of chatbots and what we might see coming up.
Well, thanks, Matt. And I, for one, am very excited to hear what Nick has to say. So I'm going to be quiet and just pass the baton right over, and I'll stop sharing my screen.
Wow, what an excellent lineup of talks. Really enjoyed hearing all of this. I'm sure the audience has as well. I am going to be talking and building on a lot of the themes that have already been discussed so far. And I'm going to be talking about a generative mental health chatbot. A lot of the motivation for this work is really based on, Ellen really, I think, went through the history quite well and described the foundations of how things are often taken and distilled down from content, from evidence-based content. Michael kind of picked up on that and also illustrated that. That this is kind of being a theme, but I'll kind of reiterate a lot of the intent behind chatbots as a solution within digital mental health or digital treatments is to really try to help engagement. So one of the things that's tricky about technology-based platforms, much like really any mental health treatment, is engagement is often a pattern where folks engage a lot at first, but then not so much after a long period of time. And this can actually impact how effective they can be. So we really care a lot about trying to make sure that folks actually interact with these tools. And I'm going to be talking today about essentially chatbots and really building up on what other folks have already discussed, like the translation from what used to be manualized treatment protocols that are delivered in session that made their way onto the web And then they were broken down in large part to try to make them more engaging, which I think are major pivots and potential for treatment and access, and making sure that it's bite-sized and digestible, all phenomenal things. That being said, I guess one of the things that, if you've ever interacted with a customer service chatbot, you can see how they can probably go awry. In large part, the authored chatbots or what I will call authored chatbots are things that are broken down by if-then statements planned out ahead of time by a team. And they have to really understand and intend where conversations will go, right? You have to be able to anticipate all of the different ways that conversations could develop. And the problem that I see with this is conversation is incredibly fluid and unpredictable. It's dynamic. Like real conversation is often this way. So like my example on customer service menus, or a team of people that didn't anticipate the intent of what their users correctly is, please select an option above. Let me see the main menu. Please select an option above. See original options. Please select an option above. Go back to all choices. Please select option above. This bot is stupid. And this can happen if we don't anticipate what our users will expect. And I think in a lot of ways, we often can't do that when we're predefining what our responses could be. So there are some modern advances and some deep learning architectures that allow us to not have to predefine what our responses will be ahead of time, and allow models to kind of incorporate dynamic responses to these things, much like a human therapist could. These models learn a lot like babies, rather than being told what to say, like specifically in response to this exact thing. They learn by example. So we create dynamic generative content for them to learn by, and much like a baby taking in the world, they try to learn to talk and to use things, and to use therapy in a real way. We've done this iteratively, and I'm going to talk to you about the early stages of this work and then kind of where we are now. This work is incredibly challenging because it's by and large actually something that is dynamic, and like part of what can go awry is if something doesn't work well, it can fail miserably. And so particularly I'll talk about some of like the examples that we've been doing this for years and years and years. And before we really are releasing this out to the world, we did a lot of rigorous testing to see how this would go. And so we started with the idea, massive amount of data online on peer support networks. What if we just try to use that data to try to inform treatment? And so we started with these mental health forums and peer support to try to see if we could just build a chatbot based on that. And we trained these large deep learning models on it, and they could emulate speech well, which is a good thing. But the way that they responded to mental health concerns were often not great. So our example here is an input from a user saying, I'm feeling depressed. Sometimes I feel like I don't want to get out of bed. And then the response being, life is such a struggle. Most days I don't know how I have the energy to go on. I end up wanting to cry alone in the corner. I just want my life to be over. Obviously not what we would intend to tell a user. This would never be something we'd want to put into the world. This, if anything, could potentially be harmful. So we put the brakes on that. Peer support networks with massive amounts of data, that's not a good idea, at least in my mind, having actually used it. Our next thought was, okay, well, I had access to thousands and thousands of therapy transcripts with hundreds of thousands of lines of conversations that were used as example training for psychotherapists. That's got to be good, right? So maybe we'll just try to train it to talk like a psychotherapist based on evidence-based content. And unfortunately, the problem that we had here was, again, it learned too well. It learned all of the bad habits of a psychotherapist. Because these chatbots can learn how the crutches in speech that folks use. And one of the ways that psychotherapists often talk is some of the things that they might say are things like, go on. And that happened with the chatbot we were developing next on this. And so that didn't work well. It often then it had also interpretations about one's mother or father that came out of nowhere and didn't make a whole lot of sense. From that, I kind of wanted to shift directions into curated expert content where we are manually creating what would be expert content, expert ways of responding to messages. And instead of relying on a predefined corpus, really trying to do it ourselves. So we've had a large number of folks that have been working on this with me and have been working on evidence-based content and developing exemplars. We've done this with eating disorder prevention space of a chatbot that we're going to launch in a clinical trial in a near future here. And over time, our chatbots have really gotten better and better. The last time we've taken a systematic inventory is months ago. I think it's actually gotten dramatically better. I'm going to show you a prototype of something that I interacted with just last week, just to give you a sense of what these actually look like. So this is Therabot. This is the chatbot we created. The little guy moves, so it's animated. We had a team of designers that worked with us on this, and it responds dynamically to the content of messages, both in its expressions. So it responds based on what the incoming messages, but it actually generates text that we've never told it to say. So we didn't tell it, I'm sorry to hear that. What makes you feel self-conscious about your body? It was generalizing that from other examples it's learned of similar types of conversations and appropriate responses to those things. So in large part, this is kind of what real conversation might often look like, and it's dynamic and it can be responsive to exactly an individual's concerns that they're putting in. So this is what I think one of the ways that I think is a way forward in terms of something that could be dynamic and fluid and actually match what human conversation actually looks like. So thanks. That's what I had planned for today. I want to thank my collaborators, pretty much all of whom are here or have related to this, the chatbot space. And I also want to thank my lab. This work was not done in any circumstance just by myself. It was done by a team of folks who made this work possible, and we're excited for the directions that it could take for the future and for how this whole field is moving forward with all of these experts that are trying to drive and shape the delivery and access to mental health care and make that available. So really excited to share this with you all and hear all of everyone's thoughts here.
Well, thank you all for sharing everything today. I really enjoyed seeing this. I love the ability to share how one grant was able to have such an impact on really the future of mental health care and the services that it can provide to people from so many different levels and eliminate so many different types of barriers across the population specific to eating disorders, but we can clearly see how the greater mental health space can be impacted by this as well. So I want to go ahead and thank really everyone here for all of your contributions, not only to your own personal projects, but to the field at large and the future of the eating disorders and body image community and mental health space.